Welcome to ChiroSphere, where we talk about all things chiropractic and some things not so chiropractic. I'm Dr. Ray Foxworth, your host for ChiroSphere and CEO of ChiroHealth USA, the network that works for chiropractic. Today's guest is Dr. Kyle Bryant, a University of Western States graduate who's been practicing chiropractic for over a decade. He's the founder and primary instructor of the Functional Extremities Chiropractor, FEC program, a system designed to help chiropractors incorporate extremity assessments and adjustments into a dynamic, repeatable, and powerful approach. Dr. Bryant currently practices full-time at his hometown clinic, Integrative Chiropractic and Extremities, ICE, very good, in Kennewick, Washington, where he specializes in chiropractic care, whole body movement, and low-level laser therapy. Beyond his clinical work, he's also working on a book and patenting an invention we may or may not get a reveal here today, all with the goal of expanding the reach of chiropractic for whole body, lifelong wellness. Welcome, Kyle.
Thanks, Dr. Ray. Appreciate you having me on.
Absolutely. So I always like to get started with people's journey. My mom and dad were both chiropractors, and believe it or not, they never encouraged me to go into chiropractic. I just figured out that's finally what I wanted to do for the rest of my life. What led you to chiropractic? What was your experience?
I would say, I didn't see my first chiropractor till I was, younger teen, 13, 14. And it all happened because my mom was in a serious car accident. And I didn't know anything about chiropractic, never been to one before. So I shadowed a couple of her appointments and got to know her chiropractor. And I just thought he was a really neat guy. And I think he could tell I had some interest in what we were doing. At the time, I was heavy into soccer. So I knew that very little about the human body other than when you had an injury, it hurts. So he was kind of talking to me in the context of how chiropractic could apply not just for pain relief, but also performance. And I always remember he had a chart up on the wall of the autonomic nervous system and he pointed to it and he was just like, "Hey, Kyle, see how everything's connected?" And I was like, "Wow, yeah, that makes a lot of sense, I guess." And so that's always kind of stuck with me. And then as the years went by, he actually became a little bit of a mentor and encouraged me to, he just kept saying over the years, "This is the best job in the world. This is the best job in the world." And so as I had soccer continue to be my driver up through college, then I kind of had that light bulb moment when I met a really neat chiropractor that worked for the school, and got to see more of the sports angle of it. And just it kind of from that point on allowed me to know where I was going to go with wanting to pursue chiropractic school. So
Good thing your mom took you with it, took you with her to those appointments.
yeah,
So I mean, I think I may have heard the answer to this already in your prior statement, but um, what specifically led you to start focusing on extremities?
I would say a lot of it did have to do with my upbringing with sports. I had a broken knee when I was 14, 15, had torn my ACL in college. And then with the experience I had with that sports chiropractor, I just kind of was in the back of my head. So when I entered chiropractic school, I was already thinking in terms of, okay, how does the whole, human body connect, not just integrating the spine, but also with the extremities. And then my first job out of school, I practiced in Ireland. I was able to be a team doc for our local soccer team there, which I got some good hands-on experience with extremities there. Then when I returned back to the States, I worked for a doctor in Spokane, Washington, who had a CCEP, certified chiropractic extremities practitioner, which at the time I had no idea what that was. But I loved his way of practice. Dr. Morehouse, he was a very significant mentor as far as my career is concerned. And that just kind of paved the way. So once I got my own certifications for CCP and then started integrating it in practice very regularly, then, there's kind of no going back from that point.
Got it. So is most of your practice now focused on extremities and sports or whole body care
We first
or
started the
full
clinic,
realm? Yeah.
when we first started the ice clinic here, I think my aim was to be more focused on extremities, but just like I imagine most of us when we get into practice, you kind of treat what walks through the door. And I was treating a pregnant lady the other day and just saying how pregnant patients are some of my favorites now, like a place I never thought I would be. But we essentially treated our clinic, full family, athletes, geriatrics, pediatrics, but we incorporate extremities into spinal function. So it is something that we take that approach with pretty much every patient that walks through our doors.
Got it. So you practice for more than a decade now, and like I said, you run integrative chiropractic and extremities in your hometown. How does serving the community you grew up in influence the way you practice? And let me preface the question. When I graduated, I went back to Yazoo City, Mississippi, which is where my parents practiced, and it was a little bit of a challenge because all my buddies that were there that went through school with me, grade school and all, it's like, I went off and I became a chiropractor and I came back, but I was still Ray to them. What did you encounter when you came back to your hometown? Any particular challenges around that?
That's a great question. I remember my boss in Ireland. He said, "Hey, when you first, your first couple jobs after you get out of school, go live somewhere away from home and make all your mistakes there, and then where you want to go settle down, then you're a little sharper." So I feel like I learned a lot in those, between Ireland and Spokane. So when we moved back, I had a very um, confident viewpoint on how I wanted to open the clinic, run the clinic, and educate people about chiropractic. And I personally come from a family where no one outside of my mom that I knew had even seen a chiropractor. And I remember telling my grandparents initially when I was going to chiropractic school, they were like, "That's a waste of time. Why would you ever get a new profession like that?" So already I kind of came in with a little chip on my shoulder, um, in that regard, not in a bad way, but just more to, educate them on how beneficial chiropractic is and really how it can just, change lives on a regular basis. So I think that's kind of the angle I carry on into practice here in my hometown. And I'll see, kind of like you said, I'll see family members or people I went to high school with that, call me Kyle, and I'm pretty casual about it. But I figure if they're utilizing our services, the more the merrier.
Yeah. You know, uh, uh, all of us who have been in chiropractic, I think whether we had a chip on our shoulder when we started or later on in our career, it feels like that sometimes. But people are usually down on what they're not up on. And it was strange in all my years of practice. Probably the patients I enjoyed the most were the ones that came in and, well, I'm here because my wife made me come in, but I don't believe in this crap, and or the ones that on the phone, they said, well, I want to come see Dr. Foxworth, but I'm not going to do all that exam and x-ray crap. I'd take a box of film on them. I'm just kidding. That's not true. But it was fun to engage with those people that had certain perceptions, preconceived ideas about chiropractic, and that really became something I enjoyed doing, is helping them figure out why they thought that way and why they may want to think a different way. And interestingly enough, that's kind of what parlayed my experience into, wow, 80 something percent of the patients with back pain are going to medical doctors. They don't know what we do. Why don't I go have that conversation? And the rest is history, as they say. We ended up being part of a spine center with 13 MDs, and so we apparently got the word out.
Wow.
So with your practice, I mean, when you first opened the practice, you're obviously doing this for your patients. What was the aha moment that inspired you to say, "Hey, let's turn this into a system that is teachable and repeatable"?
So I would say some of that started in Spokane so I got my certification when I was in Spokane, and then from Dr. Morehouse, he kind of had this approach that I think he had come up with himself that combined some of those protocols. And for those watching or listening that don't know what CCEP consists of, it's essentially, for every extremity joint, there's a muscle test that you can do to test for weakness, and then there's a correlating adjustment. So, feeding off of that, feeding off what I learned in Spokane, then I started kind of implementing this system that's whole body and incorporates the spine. So assuming that you have the neurologic influence of L5 on the strength of the muscle around the hip, you have to make sure you're addressing the spine first, but then that might allow you to work downwind and better diagnose what's going on with those extremities based on strengths and weaknesses, and those compensation patterns. So when we started ICE, I started using the system that I kind of melded together, and it started evolving over a couple of years because now we've had ICE open for over 8 years. And I've just had a couple of people over the years, mentors, other chiropractic buddies, be like, "Hey, this is kind of cool. You might want to be making this into a system that you can teach to other chiropractors because it could really help a lot of patients out there." And then I had Paul Reed puts up an event in the Pacific Northwest called ChiroFest every year,
Hmm.
and I went with Dr. Perry Barnhill and Julie McLaughlin. And ironically, I didn't say this part of the story earlier, but Perry Barnhill was my original chiropractor with my mom way back when. So kind of cool how this has come full
Yeah.
circle. And just had that light bulb moment. And this was about almost a year ago now, where they were like, "Hey, it finally just snowballed to that point. They were like, you need to get this on paper. You need to make this a class." And so they really kind of nudged me in the right direction, and ended up grabbing a partner who was one of my good buddies from chiropractic school, Dr. Jeff Staley. And we've just put the content out there, recorded things, and turned it into a full blown class now where we have currently have 2 programs worth of it, but we're eventually going to make a third and then a certification.
Got it. So, are these programs that the chiropractors can take in online, or are they live events? Because when you're talking about extremities, I mean, are you getting into techniques or just how to incorporate evaluation of the extremities into their day-to-day care?
Sure. So my system, it's basic the Functional Extremities Chiropractor. It allows you to cruise through each major extremity with an assessment and then have an adjustment that is essentially the fix. But it also allows you to adjust only what needs to be adjusted, not more than it needs to be adjusted. So there's that technical side of things, that where we do walkthroughs of the assessments, we do walkthroughs of the adjustments, and they're relatively easy modules to swallow. I mean, they're like 3 to 4 minute videos, kind of walk you through each one of the basics, and allow you to progress naturally throughout the course of those modules. But the way that we structurally design the programs is, uh, I mean, I don't know about you, but our experience with chiropractic extremity adjustments, or at least mine, you learn some in school, and if you didn't use it in practice, it kind of went to the wayside a little bit. And then I did a couple of seminars over the years, and it's just the fire hose, in a weekend, and then they slam you in the face with it, and you're expected to remember it, practice it a bunch on patients when you get back in practice. So I was trying to take those 2 extremes and find something maybe in the middle that would allow docs to be able to just watch videos over and over again, study the clips, make it a little more modern in that regard. And like I said, kind of easy to swallow. We're still in more of the initial phases of this, but eventually I'd like to get some seminars going on, hands-on seminars, because after a while, I think between our 2 programs now, we're up to around 40 modules. So it can really build up fast, but in my opinion, I think it's a relatively straightforward, simple system to learn. And I think when I was talking to Dr. Staley, my partner, he was like, the thing is not just with extremity adjustments, but techniques in general within chiropractic, you always, you feel like you have to be a master with it right away. You got to learn it on the weekend, and then boom, you're the, best person in
Good
town.
luck with that.
Yeah, exactly. So we tried to make our initial program we call FEC Foundations. So those adjustments are pretty simple. The good majority of chiropractors, a few practice swings at that, you could knock it out. But then as you grow in confidence with your repetition, the material gets more advanced, and we dive deeper into more of a clinical reasoning and decision making along with the adjustments.
Got it. Well, hang tight while we take a quick break to hear from our sponsors. Welcome back to our podcast with Dr. Kyle Bryant. We're talking all things extremities today. So, how about share a case story in your office where you're using your system dramatically improved a patient outcome? What's been one of your more challenging cases?
Let's see. I'll tell you what. I'll give you two because I think this kind of shows some of the benefit of this system. One of them, I can remember, was earlier on when we opened the practice. She came into me with chronic left-sided neck pain. She had seen three other chiropractors. She had been to her MDs. She had done injections. She was getting to the point that they were considering nerve ablation, and pain management interventions. So with this system, the way it works is we do our spinal assessments, and then we work our way downwind into the extremities. So we start more proximally at the shoulder, work our way distally, elbow, wrist. Anyway, so after looking at her neck, obviously able to find subluxation, some muscle tone difference, some postural distortions. But when we looked at her arms and ran them through the series of tests, she had essentially no shoulder strength on that side. And I remember, again, it's been over 5 years ago now, but I remember it plain as day. Just you could see the light bulb moment go off in her eyes, like, whoa, what the heck? I can't even raise my arm. So interestingly, just as we initiated care, we only adjusted the adjacent areas of the spine around there, but focused primarily on the shoulder and strengthening the shoulder. And as the shoulder got better, took less stress and tension off of that neck. So my assumption was because the shoulder was under firing, her trap, her rhomboids, her scalenes, everything was just taking an unnecessary brunt on that side. But everybody was just kind of zoomed into where the pain was. So yeah, I feel like that was pretty cool. Probably one of my other favorite stories is I had a kid come in when he was an eighth grader, actually maybe even a seventh grader. His mom had never been to a chiropractor. He had never been to a chiropractor, and he was very passionate about baseball at the time. And his mom was concerned about bunions, and she had seen these videos that we do within the clinic, that we'll share on Facebook. And she saw, hey, I heard you address bunions. Again, knew nothing about chiropractic, knew nothing about. So over the course of, I treated this kid all the way through high school. I treated him through college, and now he got signed for the Milwaukee Brewers here recently. But I thought it was pretty cool that we started off with bunions and then worked our way all the way up, knees, hips, entire spine, entire body. And then he just had a completely, different appreciation for what chiropractic offers, not just from a pain relief side, but obviously a performance side as well.
Yeah, that's neat. Interestingly enough, I mean, as a chiropractor, I'd like to think that, I'll just tell you a personal story. My daughter, who's now 32, will be tomorrow. She was run over when she was 6, run over by a Suburban pulling a travel trailer, fractured pelvis, humerus, and femur in a lower body cast for about 6 months after that, just dealing with all of that. Long story bearable, as a result of all that, she started having right SI joint, right-sided low back pain. Then it started going down the leg. She would literally lie in the bed at night, and if she turned her foot in, rotated internally, the fibula would subluxate, and she would scream out bloody murder. So long story bearable again, I'm in a spine center. I've got all the neurosurgery, orthopedic, physical medicine, rehab, PT, you name it. We had it there. And so she saw all my buddies, and no one was really able to really figure out what was going on with her. And here I am, a chiropractor. I mean, this is just not making any sense. She has essentially negative findings on imaging. Um, it, she went through epidural inject. I mean, we ran the whole course, and lo and behold, at that time I had run across Mitch Malley, and we flew in to his office the day before Thanksgiving, and literally, I'm saying this so people understand the importance of looking at extremities. So here I am, the dad, too close to the forest to see the trees, and Mitch comes out and he says, "Ray, I know what's wrong with Reagan." He said she was in that body cast or below waist cast for 6 months. Her foot never hit the ground. She lost all motion in the ankle. And believe it or not, after a couple of years of trying to figure this out, we leave Davenport and she was pain free.
Wow.
I mean, and literally, I mean, when he demonstrated how much mobility she had lost in her ankles, it's like, my God, how do I miss that as her father and as a chiropractor? And, it just really made me start thinking more about, these people are coming in with, and they're not responding to what we normally do. You got to look further. And, you know, who, who wasn't, not Kent Greenwald, but his dad said, look to the feet. Uh, for a lot of problems that we have, and I think there's a lot of truth in that.
Yeah, man. That's quite the story. Well, and I tell patients quite a bit that, unfortunately, when you have an injury to your lower extremity, you can't, I mean, unless you have crutches or another device, you can't really choose not to use it. So you have to compensate. And those compensation patterns build over years. An ankle sprain can turn into opposite side knee pain,
You bet.
a hip issue. So
Yeah. So besides I want to ask you something about the business side of your practice, if you don't mind,
sure.
because we work with an awful lot of chiropractors, and we know all the things they do, the things they don't do, how they build, things of that nature. And, there are those that will do extremity work and bill for it separately. It's got its own codes. There are others that just wrap it into their office visit. And I think partly because, well, geez, they're already paying, 65, $75. If I do an extremity, it's going to be over $100. So they're trying to manage the patient's pocketbook rather than managing the patient, which is a problem. So in your day-to-day practice, what's your experience been like when you're treating someone, let's say just for spinal issues, and then you come along and see they've got an extremity issue? Walk me through that conversation with him. Is there ever any discussion about that being an additional service? Do you get any pushback from that? Because I think, let's face it, doctors do what they're comfortable doing. And if it's uncomfortable for them to bill for that and identify it separately, they tend not to do it, which means they're leaving an awful lot of revenue on the table.
For sure. That's a great question. Yeah, and I think some of my mentality around that evolved as ice continued to grow over the course of time. But how we typically bill, well, let's put it this way. So a lot of my underlying approach to and perspective of chiropractic is focused on I really like a lot of the information Dan Murphy shares. I've gone to his seminars over the decade. Just listened to Dr. Heidi Havoc this last weekend. So a lot of this brain-based care.
So
So
how many F bombs did she drop?
they were perfectly timed. I mean, I think I laughed every single time.
She's strategic. For those of you that don't know Heidi, you need to go see her and leave your sensitivities at home.
Oh yeah, no, she brought the house down. It was awesome. But I mean, the idea is we're doing all of our treatments are trying to fulfill the deficiencies in the brain of that patient. So in most cases, anyone for me that comes in with chronic low back pain, I'm probably more focused on what their lower extremities are doing. So again, with this functional extremity um, chiropractor approach that we use, we screen all of these things. So it may not be a problem. We'll look at the ankles, knees, and hips. They might be functioning just fine. But pretty much with everyone with spinal pain, you're going to find one leg is under firing. And it might zigzag, it might be the whole leg. There could be any number of patterns. So we do those assessments on every patient. So then when we treat them, our treatment includes a spinal adjustment fee, an extra spinal fee. We also have manual therapy that we follow up with that I have a chiropractic assistant do. And then we also incorporate low level laser therapy to their parts of the central nervous system to better activate the extremity and spine and kind of sync them together. So all that being said, most our fees are kind of built in, and what we've developed over the course of time is kind of our niche reputation within town is just go here if you want to get fixed type thing. So it's not like people are just coming in for an extremity or for a spinal or for this or that. When they come in, they're trusting our doctor's perspective on what to do. And again, our treatment approaches are typically all inclusive. So our fees represent that. and we're primarily cash. I bet we're about 80-ish% cash. But we also charge a higher fee for cash. So we're not just kind of a wham bam as much. It's more of we start pricing our patients for roughly 10 to 15 minutes. But it's a little more of a higher price fee. But again, that's kind of what we're trying to accomplish.
If you're functioning as a specialist and doing something different that other people don't do, it makes sense to do that. And I'm going to give just a shameless plug about ChiroSphere, because one of the things that doctors that do extremities like about using the discount medical plan is they have the ability to set a capped fee for a visit. You document correctly, code correctly, bill it correctly, but when it comes to the fee that you charge, you can actually have a contractual network discount through a DMPO that allows you to say, my office visit is X amount of dollars. And then the patient's not worried about, oh, I don't want to do therapy today. I can't afford that. Or I don't want my knee adjusted. All that crap goes away when the patient has a fixed fee. And it just makes it so much simpler for those that may not be comfortable billing out an extremity. I want you to bill it out. I want you to identify that it was done, but it absolutely can be wrapped into a set, a set office visit fee. So
No,
let's
I
talk.
think yeah, I think that's a great point, Dr. Ray. And I think just for any docs listening to that hear that point, I think making sure you're approaching your bill with again, because it's time of service. But I don't. If you get yourself into a position where a patient's like, I don't want that today, or I don't want this, or they're kind of doing a la carte, then you're in trouble. Because ultimately, your job is to be the doc and take care of them.
Yeah, who's the doctor? Yeah.
Yeah.
So, in addition to your practice and the extremity program, I hear you're also writing a book. Can you share what the big idea is behind the book?
Yeah, the book, again, still in the works, trying to balance time with all the other things. But it's just going to be talking about our practice, how it's unique, and our perspective on health. Again, kind of with more the intent of educating the masses in regards to chiropractic. Um, and I think now more than ever, people are recognizing, hey, our current paradigm is driving us off a cliff here. So
No doubt.
there's that opportunity. So that's essentially what the book is trying to do, is kind of show that um, that the human body heals itself given the right circumstances. And you need to. One of my favorite people that I listened to early on in practice, Dr. James Chestnut, and he had the analogy that the allopathic medicine is your fire department. You better be thankful when your house catches fire and they put it out, but you're in big trouble if you ask them to rebuild your house. So you got to find yourself a carpenter, which would be us.
Yeah. Yeah. I love hearing him. Smart guy. So you've said that teaching and thinking outside the box are passions of yours. What do you hope chiropractors take away from learning your system beyond just the clinical skills?
For me, I see it in how we were able to really take off with ice is that it creates a bigger funnel to catch patients. Because, in my opinion, if people only had their neck adjusted, they'd be way healthier. But how many people out there don't think they need their neck adjusted, because their foot hurts, or they're just not able to connect the dots with the different various pains in their body and the subluxations they can carry in their spine, or their extremities for that matter. So I think having the FEC system not only allows you to be a better clinician and help people with more conditions, but it allows you to attract and funnel more people to your practice in general. I think it really allows, there's like in my hometown, we have awesome chiropractors, but this has allowed us to kind of have a little bit of a niche. So ideally, when patients come in, they already know what they're getting into, and they trust us with that. So I think for docs that are looking to distinguish themselves a little bit and offer that broader clinical perspective and treatment ability, I think it can really make a big difference.
Well, we're going to be wrapping up here in a couple of minutes, but before we do, what's the best way to reach out to you or to find out the details on the program if it is in fact something they can access online?
Yeah, any docs that would be interested in learning more, I mean, you're welcome to reach out to me personally. My email is drkyle@iceclinics.com. You can also reach out to our admin email for the Functional Extremities Chiropractor. So it's admin@functionalextremitieschiropractor.com if you have any questions. Very simply, probably the easiest way is to just go to our website, www.functionalextremitieschiropractor.com. And that kind of lays out all the basics, has some quick videos, descriptions, those kind of things, goes over pricing. I would say for any docs that are interested, because we haven't created the certification yet, the entry fee to start the programs is relatively low. So now is really the time to get in, study the material, and kind of build with us as we develop those programs and certifications. But if not, just keep an eye on us. We have a group on Facebook that you can find that's free access, gets docs talking about extremities. So yeah,
Awesome. So I've got some just for fun questions. Who's your hero and why?
ooh, that's a good question. My dad, he is the epitome of what a good man should be.
That's well stated. What talent do you have that most people don't know about?
Ooh, that's another good one. I feel like I can identify a song within 2 seconds.
Ah, a human Shazam, huh?
Yeah, there you go.
And the last one, what's the worst job you ever had?
Ooh, that's another good one. I was a intern at a rock mining pit in college, and uh, as an intern, they gave me the worst possible jobs you can imagine. And in Tri Cities, Washington, we easily get into triple digits in the summers. So I'm working in a rock pit in jeans, getting grunt jobs, and definitely had the conviction that chiropractic is where I need to go.
Yeah, yeah, you found out all the things you didn't want to do the rest of your life. Yeah. Well, thanks for spending some time with us today, Kyle, and thank you all for listening to the ChiroSphere podcast. Please subscribe and share the podcast with your friends, and let us know who you'd like to hear from in the future and what topics you'd like us to cover. We'll do our best to deliver. Doctors, if you're offering discounts of any kind in your office, you need to make sure you are not breaking state and federal rules and regulations on dual fee schedules, inducements, anti-kickback violations, which can all lead to serious fines and penalties. We can help eliminate these concerns by using our profitable discount strategy, which ensures that any discounts you offer are 100% compliant and, most importantly, profitable. It all starts with a no cost, no obligation phone call to find out if we can help you, like we have literally thousands of other doctors nationwide. Many of our doctors have seen a 20% increase in revenue and a 50% retention of patients who are part of our network. Over the past 17 years, over 7,000 chiropractors have helped over 4.3 million patient family members get the care they need at a cost they can afford. If you want to increase your revenue and retention and practice with more peace of mind, call us at 888-719-9990 or visit our website at chusa.com. That's CHUSA.com to find out why ChiroHealth USA is the network that works for chiropractic and you. Thanks again, Kyle.
Thanks again, Dr. Ray.
You bet.